Good afternoon, everyone. Welcome. We're going to start in just a moment to allow folks to enter into the meeting from the lobby. My name is Michelle Cunningham, Marketing and Outreach and Health Workforce Development. We are excited that you have joined us today. Before we begin, I'd like to discuss a few housekeeping items. The webinar will be recorded and posted on our website in approximately 7 business days. The chat option will be open during our question and answer session, which is at the end of this webinar. At that time, please feel free to place questions in the chat. We've allotted a lot of time for the Q&A session. This slide deck is posted on our website. And I'm thrilled to introduce our first presenter, Ben Gamache, Policy Analyst with the Health Workforce Development here at HCI. Thank you.
Hello, everyone. Thank you so much, Michelle. As Michelle mentioned, I am Ben Gamache, Policy Analyst for the Healthcare Access and Information team. Next slide, please. So for some of you, this is going to be brand new information, and for some of you, you have seen this before, but we do feel it's really important to always go back to our guiding principles and really why we are here in the first place. So why are we creating this behavioral health coach role? Our previous budget in 2021-2022 included a $4.4 billion investment and a 5-year plan to transform the behavioral health system for our children and youth. And as part of that, HCI received $338 million to design and build the behavioral health coach workforce. So the behavioral health coach workforce has several guiding principles, specifically increasing the overall capacity to support the increasing behavioral health needs of youth. And specifically, we're focusing on youth and children aged 0 to 25. We also are tasked to build a diverse behavioral health workforce. So really focusing on individuals that have lived experience and can serve the vulnerable populations where they live, study, and work in a wide variety of settings, including school, health, and community settings. Aside from just the focus on the types of groups that they're supporting, there's also some tasks that we have for the role itself, and those are filling some of the workforce gaps that exist today. Right now, there's currently few existing behavioral health roles in the 1 to 4 years of education. So there's those with certificate level, and then there's a jump into this master level and above. But right now, there's really not many with associate's level or bachelor's level degrees. We also want to ensure that the role is a desirable occupation in and of itself. So the reason we're making the role have associate's and bachelor's level degrees is because we want to create a stepping stone for those that do want to go into the master's level and make sure that there's no barriers to do that. But also, if there are those that want to nestle into the behavioral health coach as their career, we want to make sure that that is desirable by providing the appropriate training and wages so that those individuals can really make this a career of their own. Next slide, please. So there's been a lot of work done to get to the model design that we have today. That includes reviewing hundreds of pieces of relevant research, conducting multiple interviews with industry leaders, government partners, and existing behavioral health programs, and then an extensive stakeholder feedback phase where we developed the initial coach design options. We presented that to our stakeholders, many of whom are on this call today, then continue to refine that until we get to our current model. So that stakeholder engagement process took us through August, and the last 2 months have really been us diving into the implementation. There's many different things that we are working on simultaneously, but one of the big chunks is our focus on development of the curricula and the training program. Go ahead and next slide, please. So that training curriculum program has been in development with our stakeholder partners, as well as in communications with the community colleges, as well as the California State Universities. And the prerequisites to enter our programs are currently none for the BH Coach 1 role. We want to make sure that there are as few barriers as possible for those that want to enter into this program. And for the BH Coach 2 program, it requires either the BH Coach 1 certification or an associate's degree or above in a related field. So we want to make sure that those that have taken the coursework, have the competencies, can enter this program without having any barriers or having to retake any of those classes. The education program for this will be 60 credit hours for the BH Coach 1, which is the equivalent of an associate's degree. And that includes 400 hours of structured on-the-job training. And for our BH Coach 2 program, that's an additional 60 hours of 60 credit hours, which includes an additional 400 hours of structured on-the-job training for a total of 800 hours for our BH Coach 2 program. And as I mentioned, received upon completion will be an associate's degree plus certificate for the BH Coach 1 or a bachelor's degree and certificate for a BH Coach 2. And the services offered we will dive into in the subsequent slides, so I won't go into those into too much detail. But I do want to reiterate again that our BH coaches are meant to serve children and youth aged 0 to 25, operate as part of a care team, so they are not meant to supplant any of the roles that currently exist. They are meant to work with and support our children and youth as part of their diverse care team. And then they also are intended to operate under the direction of and coordination with either PPS credentialed or licensed professionals, depending on the setting. And with that, I'm going to pass that over to James Regan, Assistant Deputy Director of Health Workforce Development at HCI. James.
Thanks, Ben. Really appreciate it. And thank you, everyone, for joining. As Ben mentioned, I'm the Assistant Deputy Director for Health Workforce Development here at HCI. You may have heard from me throughout the stakeholder engagement process that we had over the last 6 months that Ben was just talking about, and really appreciate everyone's participation in that process. I mean, it was very educational for us. It was very fruitful and great overview of the model in case it was new to you. A really quick overview of Behavioral Health Coach 1 and 2 model. And now we can go into a little bit about what's new. And so on the next slide, we can start with something that probably looks slightly familiar, but we did hear from you, several of you, over the last couple of months as we got into the implementation phase, that clarifications would be helpful in some of these domains as far as what the different domains of this scope of services both is and is not. And so this is a modified version of the slide that all of you helped us create through the engagement process, where in each domain there is a clarification on what 6 domains of the scope of practice actually are not. And so hopefully you find this helpful. And I do already see some hands raised, which we really appreciate. There is going to be plenty of opportunity for Q&A at the end of this presentation. I mean, more than half of the webinar time, I think, is reserved for Q&A. And so I appreciate your patience, and we'll get through this material, and then we'll open it up for that. So to start, the first portion, of course, is wellness promotion and education. And the second portion being screening. We do have some clarifications here. This does not mean assessment or treatment of symptoms, whether that's individuals or in a group of any kind. And of course, in the screening area, this includes supporting youth and families through screening under guidance, and also with already established curriculum, not specialized screening tools. And then care coordination and extension. This is meant to be truly a supporting role to all the existing members of a care team, whether that's in a community setting, a healthcare setting, or a school site. This role is specifically meant to support the existing care team that may exist in any practice setting. And on the next slide is the 4 through 6 domains of the scope of practice. And once again, just some clarifications on what this is not that may be helpful. The behavioral health coach role does not include any assessment, diagnosis, clinical intervention, or treatment of any kind. It's specifically meant to do things that are listed here that I think we may have covered before: wellness education, goal setting and planning, life skills, and things like that. Not diagnosis or treatment of any kind. So hopefully that clarification, we definitely wanted to put that down in the slide there for you. And then, of course, lots of feedback throughout the last 6 months about the crisis referral domain of the scope of services for the behavioral health coach. And we did want to clarify that this is meant to be a role that refers to a higher level trained professional if treatment is needed, if that assessment, diagnosis, or clinical intervention is needed, then the behavioral health coach could refer to that higher level professional with that training and education necessary to do that. And that this would not be a crisis management role at all. And so ultimately, in the first part of the information that's somewhat new, we wanted to present back to you today, ultimately based on your feedback and request for clarification of really what does some of the meaning behind these domains have, and also what is it not. So hopefully this at a high level is helpful, and of course happy to answer questions about this in the Q&A session at the end. In addition to some of these clarifications, right at the top, on the next slide, we do have this reminder on the behavioral health career lattice and how the behavioral health coach 1 and 2 may fit in with other existing professionals providing that critical behavioral health care in the workforce right now, and how it relates to other existing certificate level professionals like community health worker, peer support specialist, SUD counselor, and then how the behavioral health coach 1 and 2 will ultimately, the plan is that it helps fill out that behavioral health career ladder. And in addition to being a career in itself as a coach 1 and 2, also for anyone looking to progress in their career would lead directly to those master's level and licensure level professions as well. So no content on this slide has changed from the last time you've seen it, but just hear it as a reminder for some of the purpose, and so hopefully helpful. And then a little bit more about the new and upcoming work on the next slide, I think, is some work we're doing around certification. So ultimately taking what all of the proposed coursework and topics of training and length of training and formalizing that as part of an education curriculum for both that behavioral health coach 1 and 2. So right now we are initiating the development of a certification process, starting at the very beginning, which is that education and training, that curriculum development in that middle piece. And so HCI is really putting a lot of effort to ensure that the curriculum that's developed for the behavioral health coach 1 and 2 aligns with all of the feedback that you gave us through stakeholder engagement as far as the recommended coursework and different buckets of education that would be required to provide the level of services that are proposed for this role, and also making sure that this role and the training and education that the behavioral health coach 1 and 2 receive would progress in and count towards those higher level professions for anyone that wants to progress into that master's level role or license level role. So hopefully this is helpful. A huge topic, another huge topic that HCI is working on right now in partnership with Department of Healthcare Services and Department of Managed Healthcare and others, is this idea of the sustainability of this role, ensuring that there is a billable rate through Medi-Cal and commercial insurance to ensure the long-term sustainability of this role. In addition to that, looking at the possibility of other supplemental funding opportunities to bridge the gap until those more sustainable funding opportunities are ready. And so taking a very holistic, as realistic and thorough as possible approach really across the board as we get into the next steps of implementation of this role. And really excited that you've joined us today. While there isn't a ton of information to take a deep dive in these 3 buckets yet, there definitely will be at the next webinar. And also we have these monthly newsletters that are going out with new information. And so definitely look out for those. And I think now we have some time set aside for Q&A. And then after the Q&A, there will be a portion where we will also highlight other related work supporting different parts of the behavioral health workforce that are out there providing critical care right now. And with that, I'll turn it over to you, Michelle.
Great, thank you. So during this Q&A session, due to the volume of participants, we will entertain questions in the chat only as opposed to hand raised, and the chat option is now open. I'm going to turn it back over to Assistant Deputy Director Regan, who will facilitate this Q&A session. We'll do our best to answer all of your questions. Thank you.
Thank you. So I believe chat's open. Please feel free to drop any questions that you have in there. I'm looking at it right now. Happy to answer as many questions as we possibly can in the time that we have. I do see hands raised. If you do have a question, if you're willing to put those in, and I see them rolling in now. Appreciate that. So first question is, the deck says, no prerequisites for Coach 1. Does that extend to diploma, GED, or will one of those be required? One of those will not be required. So I hope that helps answer your question. We did get pretty loud and clear feedback that no prerequisites would be, the way to go, and actually not requiring a high school diploma or GED. Next question is, what is the timing for certification process? That is a great question. Ultimately, someone would go through, for behavioral health coach 1, it would be that 2-year training, or excuse me, education and on-the-job training. And then there would be a state level certificate entity through HCI to process that certificate application. And ultimately, we're working on what that process is looking like right now, as far as the documentation required and other things. So hopefully that answers your question. Question about how we can get a copy of the deck. I do believe it's posted on HCI's public website right now. And so maybe what we can do is put a link to that in the chat shortly. And then what agency are you talking about being the certifying body? HCI will be the certifying body for the Behavioral Health Coach 1 and 2. Next question is, how will schools be able to participate in delivering certification programs? Are there already institutions selected? There are not institutions already selected, and appreciate that question. Right now, we are really going to be looking at what does the curriculum, the official curriculum look like for BH Coach 1 and 2, and then hopefully by the time we hit this next webinar and maybe one of the newsletters in between, we'll have more information based on that more formal curricula, what the process would be for institutions to get involved in becoming a training provider. Next question is, will there be a specific Medi-Cal billing for this provider type? That's what we're working on with Department of Healthcare Services right now, is determining exactly what that provider type will be to be able to bill for a behavioral health coach 1 and 2 through Medi-Cal. Good question. Feedback on slide 8 about school nurses only having a bachelor's degree. Really appreciate that. Yes, I think there is a footnote referencing the fact that there is that additional credential for school nurses on top of having a bachelor degree. Very well noted. Thank you for the feedback. Next question is the idea that they get an AA without a diploma, do colleges do that? That's a great question. One of the things we're looking at that I think we discussed throughout the process for engagement is the idea of a core competency model as well. If someone has extensive experience in this field already, would there be an opportunity to have a parallel track that does not require that diploma. So hopefully that's helpful. That may come in a future iteration of the behavioral health coach role. Still working through some of those details. Next question is, I did not see any mention of teachers and their role, yet the BH coach is delivering classroom-based instruction. Are there plans to build this into a health education teaching credential? Good question. I think when we're referencing that classroom-based instruction, it's really actually classroom-based programming. So what I think we were envisioning with that terminology was more if schools have assembly-based programming or behavioral health awareness-based programming or health awareness-based programming that would be delivered either at a classroom or assembly level that's already approved through the typical process, then a behavioral health coach could be someone on the school site care team to deliver that, as opposed to classroom-based instruction. So I hope that clarification helps. Next question is, the chart shows that coaches can move laterally into a peer support role, but peers require 6-month certification. So I think the idea there is that it's not necessarily a lateral, but it's more of a parallel track where you're correct. The certificate process for a peer support specialist or an SUD counselor is truly separate and specialized to those roles. We definitely wanted to demonstrate that this behavioral health coach 1 and 2 does not fit directly within the career progression of those roles, but rather in a parallel track to where if a peer support specialist has been providing that lived experience, that valuable lived experience care for a long time, then to go into a behavioral health coach 1 or vice versa would be an option. Next question, is there work experience alternative instead of associate's degree? Great question. I think I mentioned something before. We are looking at the possibility of a sort of core competency model where there is equivalent experience, work experience that could be substituted for coursework. That has not been fully developed yet, but more to come. Great question. What other settings are coaches anticipated to be qualified to work in? I think right now what we're thinking of is the main potential types of facilities and settings for coaches to provide services would be K-12 schools, post-secondary schools, community-based settings, including clinics, community centers, after-school programs, and also health centers as well. Question about who will be providing training and whether it's community colleges. We are talking with our community college partners right now to see if that is a possibility. But I think mentioned before, we're still working through that based on what the formal curriculum looks like in order to determine what that training provider requirements will look like. Good question. Thank you. I do see that we did get the link to the slide deck in the chat. Hopefully that's helpful. When will behavioral health coaches go live? Another great question. There are lots of factors that go into timeline planning. As of right now, we are looking at potentially late 2024 as an early time period that a behavioral health coach could be leaving a program. This really also depends on what the formal curriculum looks like and what those curriculum requirements look like as well. So we're in the process right now of translating all of your recommendations through stakeholder engagement as far as the proposed coursework into the formal curriculum for that 2-year and 4-year, and ultimately whether there are other existing education programs out there that directly fit to those needs or not. And so once that exercise has been done, then we'll know as far as which implementation method for that 2- and 4-year program will affect that timeline quite a bit. But as of right now, potentially end of 2024. Another question, on whether the behavioral health coach designation will be added to the Medi-Cal benefit. That is something that we are working with Department of Healthcare Services on, exactly what the most efficient and effective way to make behavioral health coach services billable through the Medi-Cal as Medi-Cal reimbursable services. And so we'll have more to come on that. Lots of hard work going into that, figuring out what is the most efficient and effective option, and of course taking into account the idea that we want the billable rate for behavioral health coach services to be conducive with the services being provided, and also conducive with the cost of having a position like this for employers. Question about how this role will be integrated into settings outside of schools, include community-based organizations such as community clinics. Great question. This really seeing it as a similar timeline for the sake of integration. One thing that HCI is looking at is definitely having that technical assistance very readily available for any employer, any practice setting, as a resource hosted by HCI for assistance in how to best integrate this new role, questions about the role, anything related to the role. Then that technical assistance resource will become available once we get a little bit closer to that implementation period, where there will be coaches ready to be employed across the state. So that technical assistance resource is not available now, but ultimately we're hoping that this role will serve as an early career supporting role in many settings, including community-based organizations and community clinics, etc. So I hope that's helpful. So another question on this about understanding that there is a high school diploma or GED needed to earn an AA. I am actually hearing that there is a track through California community colleges to get an AA without those requirements. And so we're looking at those things a little bit more closely to see if that would be applicable to this role as well, which I think would really allow especially groups with lived experience who don't necessarily have that GED, to go through this program, be eligible to be trained and educated as a behavioral health coach with that valuable lived experience. Great set of questions that continue to flow in. Really appreciate this. Next question is, how much flexibility will employers have in determining the duties of the behavioral health coach they hire? Good question. As long as it's within the scope of services, I think that there is some level of flexibility. For example, if an employer really needs someone on their site to coordinate that prevention and educational preventative programming for behavioral health, that awareness campaign, and that's really what the site needs, then ultimately it would be up to that employer to use the behavioral health coach role in that way, rather than splitting their time between that awareness and prevention programming and providing that individual and group support in the other domains of the scope. So I hope that helps. Thoughts on coaches for ages 1 to 25 and also beyond for dual training? That is a great question. I was actually just talking about this earlier today with a colleague. What we're trying to do now is have this initial behavioral health coach rollout and implementation be for that ages 6 to 25, with 0 to 5 being the next iteration, considering that there would be highly specialized training associated with early childhood. It's a very unique setting. And so that will be a future iteration. In addition to that, there have been conversations about whether this role could provide services beyond age 25. So possibility to raise that in the future. I don't think it's out of the question. For now, we are definitely focusing on that children and youth component as the first priority. Great questions. Actually, there's a couple of questions that are similar in a row right there. Appreciate Appreciate all the feedback. Yeah, similarly, if you have questions, please feel free to put that question in the chat. Also seeing some additional feedback in there. So if you would like to provide written feedback for us to consider as well, outside of questions, please feel free to put that in the chat as well. We'll make sure to save that. Who will develop the curriculum provided by the coaches to children and youth? Great question. That is something that we are working through with our higher education partners right now, including community colleges and CSU and UC. And ultimately, we're HCI, including me, I'm getting very up to speed on what the typical curriculum development process is for that 2- and 4-year degree level. We want to make sure that this happens as quickly as possible, but also it's effective. And it's something that if there's a possibility of fitting it in to the existing curriculum infrastructure through community colleges and CSUs, then why not? And so that's something we're talking with them about right now, getting up to speed and figuring out whether there is an existing program that meets the needs that all of you recommended for the coursework. And if so, what does that look like? Will there be a SPA, a state plan amendment to guarantee reimbursement? Great question. That is something, as mentioned, working through with Department of Healthcare Services on exactly whether there is an existing provider type that would make these services already reimbursable, or whether it would require a SPA for a new provider type. We do not have the answer to that question yet, but it's something we're working hard to have an answer on soon. Great question. Next question is, do you anticipate an RFP to develop education certificate infrastructure? I'm apologize, not sure if I fully understand the question. If this is about whether there will be an RFP to develop the curriculum, then I just a little bit more information about how we're working very hard on what the curriculum development process is going to be. As I mentioned, I think going through the existing infrastructure and how that works with other similar programs and whether that meets the coursework needs that you propose through stakeholder engagement. And then after that fact finding is done, then we would take steps to either have a curriculum developer and or figure out another method for making sure the curricula gets developed and implemented. Right now, there's a high degree of confidence that our partnership with community colleges and CSUs will, get us up to speed on what the options are as far as curriculum development, and then we'll go from there. Great question. Question about the DHCS reimbursement. Will HCI DHCS be looking at the combined feedback of other roles such as CHWs and peers to develop solutions around barriers to integration, such as inadequate pay and high cost markets? Great question. That is something we are being very deliberate about, is looking at other provider types and whether those reimbursement rates would be adequate to cover the services of behavioral health coach 1 or 2. And if not, then pursuing an option that gets that higher billable rate for the services provided by behavioral health coach 1 and 2. But we're really dedicated to making this sustainable. It's not realistic for employers and different provider settings across the state to employ this 2-year and 4-year trained and provider services, and then getting a very low reimbursement rate. And so we want to make this realistic and sustainable for everyone. Great question. Another question. Could this fund LEAs through their LCFF funds? Great question. I will have to take that one back. Really appreciate that. Ultimately, HCI is looking at different sustainability options for including direct grant awards to potential employers. of
And James, I
behavioral
can
health
jump
coach.
in
And
real quick as well.
okay,
Sorry to cut you off, but in some of our stakeholder feedback, we were told that we want to try not to touch the LCFF fund just because those are limited and ideally being used for other resources. But one thing we are doing is working with DHCS to discuss adding coaches to the all payer fee schedule and really looking at this new fee schedule development as a great way for reimbursement within school settings. So that is something that we are very much considering and making sure that we can try and find a easy way to get reimbursement in school settings.
appreciate it, Ben. Appreciate it. Lots of feedback streaming in. Another question. Could a provider offering peers also become coaches who also become coaches bill both for the same encounter? Good question. Ultimately, I think the billed services provided by a peer versus a behavioral health coach would be different. And they're really, I think the peer support specialist role, the certificate process is different. The services being provided are different. So I think HCI envisions this as a separate billable rate and reimbursement for behavioral health coach. Who will do the training during the 400 hours? What will that look like? Great question. That is something that, once again, exploring with our higher education partners to see what other models exist out there, because there are other vocational training programs out there that include that on-the-job training or a practicum component for a certain number of hours as part of the education. And so I think right now the hope is that we would adopt a similar model for behavioral health coach 1 and 2, where those on-the-job training hours would be embedded in something that is coordinated and hosted by the training provider as the behavioral health coach candidate is going through the education. So hopefully that helps. Appreciate all the feedback in here. We're definitely recording all of this. There are some, I think, repeat questions in here. Scrolling through, all great feedback. Will parents have to consent to their children interacting with these providers? Great question. We would envision that behavioral health coach 1 and 2 would fit within the existing consent structure in schools. And one of the things that we did hear loud and clear through stakeholder engagement is that there would have to be that consent portion built in, especially for behavioral health coaches providing services in school settings. Appreciate that. Yeah, all kinds of great feedback. I'm scrolling through. I do see a comment that the understanding is that DHCS is now allowing schools to bill for Medi-Cal funding. I don't know that that's true. And that is something that we are taking into consideration when designing the reimbursement option for this through Medi-Cal. I have reached the end of the string. And so if you do think of other questions or feedback that you would like to provide us, please feel free to email us anytime. We have all kinds of engagement options, in the end of this deck that I'll go over in just a minute. Feel free to email us anytime. There'll be an email address up on the screen. We can probably also put it in chat at the end. We will also have opportunities to attend these future webinars. I think we're planning on doing another one in January. There's going to be a ton of new information at that point, especially around curriculum. So one thing, I see the clarification around there needing to be a medical diagnosis to receive reimbursement through Medi-Cal when it's a school site. Really appreciate that point. and requesting the team take direct note of this as we work with DHCS to see if there is an alternative option for the behavioral health coach to be billed, considering there is no diagnosis component of the behavioral health coach services. How can we make this happen? So really appreciate that. What we did also want to do before moving on to the engagement options, there's the email in the chat right there. We also wanted to highlight the idea that there are many other health workforce related programs that HCHI is hosting to support all different behavioral health professions in the workforce now. So just want to highlight these. If you get the chance to access the slides, these are each actually linked to the page on our website with more information, but at a very high level, HCHI is hosting a number of loan repayment scholarship programs for a bunch of health professions, including behavioral health professions at every level, to help promote financial support aspect of becoming a behavioral health professional, understanding not everyone can afford to do that. In addition to that, there are 2 education capacity expansion grants that we are hosting right now, including one in psychiatry and one in social work, that ultimately we're looking to increase the number of slots in schools, for psychiatry residencies, and also schools of social work at the bachelor's and master's level to really help increase that workforce and that throughput at all levels. And then, of course, a long-standing program here at HCHI is the support of the Peer Personnel Training and Placement Program to recruit and train and certify peer personnel, a very crucial early career workforce with lived experience, providing that relatable service to other individuals going through things that they've already been through. And then our brand new up and running pipeline suite, and we call it the Health Professions Pathways Program. There are several modules as grant opportunities for organizations looking to host career development mentorship programs around behavioral health, summer internships, I believe, as well, for that high school and post-secondary level. And so we're very excited about that. We had the first grant cycle completed over the summer. A lot of new opportunities going into that grant coming up in late spring, again, for cycle number 2. And so hopefully what we're trying to do is support behavioral health professions as holistically as possible across the career lattice, in addition to helping fill out that career lattice with Behavioral Health Coach 1 and 2, also supporting all of the other great professions already providing care as part of the care team across the state. And so we're really excited about that. And I do appreciate additional feedback on program access. Happy to send out a little bit more information after this as well. And so I think on the next slide, there are opportunities to stay engaged, and really any feedback you have or questions you think of after the fact. We are going to continue to host these quarterly webinars as a way to make sure this contact and collaboration stays open. There will also be monthly newsletters with updates on the status and progress of behavioral health coach implementation. And there are also broader health workforce related efforts, including the ones that, Snapshot just went over around behavioral health. HCHI typically sends out workforce programs update via email every month at the beginning of the month. So if you're interested in learning a little bit about the broader health workforce support programs that we're hosting, in addition to the ones that I just went over in a short list, please feel free to subscribe with us and subscribe to the email list. The link is here. And also there is a Children Youth Behavioral Health Initiative website, or web page, excuse me, up on HCHI's website now. If you're interested in taking a look at that, looking at a little more detail of the breadth of CYBHI programs that HCHI is supporting right now, please feel free to click the link there. And then the team was able to put that contact email in the chat a little bit ago, but in case you missed it, it's right here. If you have additional questions or feedback, please feel free to email us, reach out anytime, cybhi@hchi.ca.gov. And really appreciate everyone's time. I know this is a complex topic with a lot of different things going on, a lot of different components, and your engagement in that stakeholder feedback period over most of this year was really foundational to getting us where we are. And so huge thank you to that. That engagement, your time, everyone in this room is incredibly busy, and the fact that you took the time to participate in this webinar, participate in that engagement process with us, really love that, and we'll continue. And so, Michelle, I don't know if you had anything on closing. We are coming up to the end of our time.
No, I think you covered it all. I like the feedback, the robust discussion, and please email us. Thank you.
Thank you so much. Have a great evening, everyone.